Access to medical care is often taken for granted in many parts of the world. Hospitals, pharmacies, and emergency services form a system that most people rely on without much consideration. In everyday life, professional medical assistance is usually available within minutes or hours. However, there are situations where this system becomes unavailable or difficult to access. Natural disasters, infrastructure failures, remote locations, and periods of civil disruption can limit access to professional healthcare services. In these scenarios, individuals and households may need to rely more heavily on basic medical knowledge and self-care practices. Throughout history, many communities have relied on practical medical knowledge within the household. Families learned how to treat minor injuries, manage common illnesses, and respond to urgent health situations while waiting for professional care. Printed medical reference manuals have historically served as tools for organizing this type of knowledge. These manuals typically combine explanations of symptoms, descriptions of conditions, and step-by-step procedures that can be followed outside a hospital environment. The publication known as the Home Doctor, Practical Medicine for Every Household fits into this category of household medical reference material. The Home Doctor is a medical preparedness manual consisting of approximately 304 pages of written content. The material is presented as a structured guide intended for non-medical readers. It compiles a range of topics related to basic medical awareness, household treatment practices, and emergency response considerations. The book is organized into multiple chapters that focus on different areas of health. These include topics such as skin injuries, respiratory illnesses, cardiovascular warning signs, digestive issues, infections, and minor surgical situations. Many sections focus on recognition of symptoms. These chapters describe observable physical signs that may indicate conditions such as heart attacks, strokes, arrhythmias, or infections. Other sections focus on procedures that may be performed at home when professional care is not immediately available. These include wound cleaning, basic treatment steps for burns or skin conditions, and guidance for handling common injuries. The manual also contains informational sections about medications. Some chapters discuss categories of drugs, their general uses, and considerations surrounding storage or expiration. In addition to treatment topics, the book includes sections about medical preparedness. These chapters outline examples of medical supplies that households may keep available. The publication also references supplementary digital documents related to edible plants and traditional natural remedies. The book functions primarily as a reference manual rather than a continuous reading experience. Users typically interact with the material by consulting specific chapters when a relevant situation arises. For example, a reader might turn to a section discussing skin injuries, abdominal pain, respiratory symptoms, or dental infections. The structure allows the reader to navigate the manual based on categories of symptoms or types of injuries. Some chapters contain diagrams that illustrate parts of the body or procedural steps. These visuals are intended to support the written explanations. The instructions presented in the book are generally structured as step-by-step processes. These may include identifying symptoms, evaluating conditions, and performing certain actions within a household setting. In addition to emergency scenarios, some sections are designed for preventative awareness. For instance, chapters may describe how to recognize early warning signs of certain medical conditions. Because the material is written for non-professionals, the explanations typically avoid highly technical medical terminology and focus on observable symptoms and practical procedures. The manual does not replace professional medical training. Instead, it functions as an informational reference that readers can consult when seeking guidance about common medical situations. A reference manual of this type generally aligns with individuals interested in preparedness, self-reliance, or household health awareness. Some readers may approach the book from a preparedness perspective, where the focus is on planning for situations in which professional services might not be immediately available. Others may use it simply as a home medical reference guide for learning about symptoms, minor injuries, and general health conditions. People living in remote areas may also find value in structured medical reference materials, particularly when distance from healthcare facilities creates delays in receiving treatment. The book may also appeal to readers interested in historical or traditional approaches to medical care, including practices that were commonly used before the widespread availability of modern healthcare systems. Medical reference books for household use have existed for decades. Earlier examples include family medical encyclopedias and first aid manuals. Compared with basic first aid guides, the Home Doctor covers a broader range of health topics and includes longer explanations of medical conditions. However, it remains significantly less technical than professional medical textbooks used in clinical education. In terms of structure, the manual sits between two categories: first aid handbooks and general medical encyclopedias. First aid guides tend to focus on immediate emergency procedures, while medical encyclopedias often provide detailed academic explanations of diseases. This manual instead concentrates on practical recognition of symptoms and simplified procedures that can be performed within a household environment. For viewers interested in examining the material directly, the instructional documentation referenced in this video is available through the link provided in the description.